What is the duration? So if this paper speed is 50 millimeter per second, so what do you feel inside here? What is the duration? Roughly, how many box do you think it is? I don't think I can make it any bigger. How many box do you think it is? Come, somebody just shout. How many box do you think it is? 1 box or maybe 2 box. Okay, let's say if it is 2 box. So if this is 50 millimeter per second, so this one is about what? What is the duration? Not 0.04 meh? 2 small box. 1 over 50. Use a calculator. 1 over 50 is 0.02 per that small little box. So if it is 2 box, so 0.04 second. Okay? Okay, here is 0.04. Configuration, nothing abnormal, right? So it's a normal sinus configuration. Okay, so you just write there normal. Okay, PR interval. How many box? The PR interval. How many box? How many box do you think? PR interval from here to here.
2 boxes, doctor. 2 boxes.
2 boxes. I think roughly it's about 3 or 4 boxes. So PR interval, you should start from here until here. Okay, you should start from here until here. So roughly there are about 3 or 4 boxes. So PR interval would be, so if it is 4 boxes, 1 box is 0.02, 4 is 0.08 second. Okay? Can? Okay, so QRS duration. How many box do you think? QRS. Okay, QRS punya duration. How many box do you think? So it's underneath over here lah. This is about what? 2 boxes? Okay, 2 boxes. So the duration should be 0.04. Okay, 0.04 second. Okay, now this one tells you the amplitude of the QRS. Okay, so if we look at the QRS, Q, R, and S. Betul? Okay. This one normally the millivolt goes by the deflection. This line is isoelectric kan? This line is isoelectric. Okay? And we know if it is the amplitude punya box, this 10 box over here, let me, okay. What am I doing? Okay. So just now, where were I? The QR. So it should be, this one is the isoelectric, right? This is the Q, right? And I wanted to tell you all is that this 10 boxes is equivalent to 10 mm. Okay, so every of these small boxes, this 10 mm is equivalent to 1 millivolt. So these 10 boxes, one small little box will be 0.1 millivolt. Okay, so very easy only. So if it is the Q, this one is negatively deflected then, and it's only one box. So you just write minus 0.1 millivolt. Okay? So if this R should be pandai already. How many millivolt do you think this is? How many boxes? Siti, what is your answer?
No, doctor.
What the R millivolt, what do you think the answer would be? Seventeen boxes. Okay, can also. So if it is 17 boxes, then that means how many millivolt? 1.7 millivolt, you are right. Okay, kalau S, so QRS, S got or not? Do you think S got a millivolt for it, or is it? What do you think about S? S is over here. So what will be the answer for S? Mira, what's the answer for S?
0.
0 also can. Plus 0.1 also can. Okay, but if you look at it, this one looks like plus 0.1, this is 0. Okay, so it's isoelectric. Okay, faham ke? Shall we understand? I'm going to start calling names already. Nobody want to respond to me. Okay, okay, so the other reports, normally it's just going to be this lah, your ST segment. What do you think? I don't think it's a slurred, maybe, but this one is okay pula. Subsequently, all okay. It was only slurred in one. Alright, so I will just say nothing. QT interval, PQRST, Q, QRST, QT interval is going to be like this. But normally, I won't even want to ask you all about it. Let's do mean electrical axis. Who wants to show their diagram, mean electrical axis? What answer did you get? Let's do this. What answer did you all get? What answer did you all get? Nobody want to answer me. What did you all get? Come. Is it mean electrical axis to the left or is it to the right? What did you all get? Weh, sayang sekalian. Apakah jawapan? Siti, what did you get? Okay, I ask Navish. Navisha, what did you get?
Doctor, I think it's to the right.
You get to the right. Okay, how did you calculate? Which lead were you looking at?
I'm
Tell
actually not
me.
sure. I'm still calculating. Sorry, doctor.
Okay, then I'll ask the next victim. Haziq, what did you get?
I'm still not sure, doctor. I'm
Not
still
sure.
quite confused still.
You're still quite confused. Okay, let's go back to basic. Haziq, if you want to calculate the mean electrical axis, which method do you want to use? Let's say if it is isoelectric, which one is isoelectric? Which one has got the smallest complex? Haziq, which one got the smallest complex? Lead 1. Okay, Muni
Yeah,
say
the
lead
lead
1.
one.
So kalau lead 1, this one is lead 1 lah, correct? Perpendicular to lead 1 is AVF, correct? 90 degree. So theoretically, if you use that thing, then your lead 2 should be going down here lah. Okay, let's make it purple. No, let's make it okay. Okay, correct? Okay, let's say if we use the other method, which is going to be, which one has got the tallest R? So it's lead upper. Which one has got the tallest R? Okay, let's find another victim. Joyce, which one has got the tallest R? If you look at 1, 2, 3, 4, 5, 6, all of these 6 lead.
And lead the lead 2.
Okay, so lead 2, then after that you'll be thinking, just now you say isoelectric, then perpendicular, you get this one. So you are also right. It's gonna be lead 2, kan? It's gonna be in lead 2. Okay, so no matter what it is, whether it's here or whether it's here, you are still right. The mean electrical axis is still between the AVF and the lead 2. Okay, so let's use the third method. Okay, let's use the third method. Shun Kai, let's say if I want to use the third method, which lead am I looking at? Which R wave from which lead am I supposed to be looking at?
Lead 3, doctor.
Lead 3 only ke? Do I only look at lead 3?
And 1 and 3.
Okay, so 1 and 3. 1 and 3 over here. Okay, so let's say I'm just gonna make a simple scale for the fun of it, just to let you all understand better. So let's say I make, this is a scale of 5, and then this is a scale of another 1, 2. This is the scale of another 5. Then I want to put another scale of 5. Okay, I simply mark like that. Then after that, I want to put another scale on 5 because Shun Kai say, Doctor, you should be looking at lead 1 and lead 3. Okay, so this is my lead 3 over here. I say, then maybe I make another scale of 5. You can make up your scale one, no problem at all. My one too small. Then you make up another scale of 5 over here. Okay, let me ask another person. Xue Kang. So if it is lead 3, how tall is the R wave?
I think 12.
Where got 12? In lead 1 or? Oh, sorry, in 3. Sorry, you're right. So in lead 3, let's say this is the height of 10 or 11, 12, 13 lah, something like that lah. Okay, now I'm going to draw my line. Let's make it another color lah. Okay, so say this is 5, this is 10, and then I want to draw 12. So perpendicular to it. Okay, so this is my cukup ke 90 degree. Okay, maybe I want to come down a little bit more. Because this is 10, this is 15, so roughly say 12 is here. Okay? Okay, ke Xue Kang? You're so quiet. I'm so bored already. Okay, ke Xue Kang?
Okay je.
Okay je. Then the next one you want to look at, lead. So the next one you can look at?
Lead 1.
Lead 1. Lead 1 berapa kotak? You rasa kat lead 1 ni R wave berapa kotak?
4.
Ni 4. 4 ke? Wait, 4 ke? Alamak. I look here lah. 4 ke? 4. Okay lah, 4. Okay. 4. This. So, saya pun lukislah line dari 4 sini turun ke bawah. Betul? Okay, make my thing nicer so that you all understand. Okay? Lepas itu, saya lukis arrow. Arrow, I changed color already. Very sorry. So now I want to add my arrow. So I draw from where? From sini ke? ABR ke? Dari ABF ke? Ke mana?
Dari
Lekat.
tengah, doktor.
Okay, bagus. Dari tengah. Alright, dari tengah, you draw the line across the transected one. Okay? Faham ke? Tak faham. Okay, very easy only, huh? So now you know your mean electrical axis is actually here. So you get this one is 60, this one is 90. So roughly tengah-tengah lah, 75 ke, then you tell me, okay, mean electrical axis is actually 75. Then you go back to your lecture notes. It's still normal. Okay, because your head is the head pula, the heart is sengit sebelah like that one. Okay, so I will show you in the radiograph what does it mean by sengit to like that, but where that is the bulk of the muscles are lah. So the mean electrical axis for this dog is roughly about 75. Okay? Okay. Any other question? Susah ke, senang ke, nak duduk nangis ke? Nak nangis ke? Pandai-pandai nangis lah you all. Okay? For me, okay, heart rate. What did you all get? Lai, what did you all get? Tak panggil nama, tak ada orang nak jawab. Florence, what is your heart rate? Florence,
Sorry,
don't know
doctor,
where.
what was the question?
What is the heart rate for this dog? We fill up we fill up everything already, but we didn't fill up the heart rate. What was the heart rate for this dog?
Hold on for a minute, doctor.
So if this paper speed is 50 millimeter per second, so you want to count how many boxes? 30 boxes. So in that 30 boxes, you get how many complexes? You get how many complexes?
Five complexes.
Okay, so let's say if I've already put here, I was doing my own calculation just now. Let's say if I've got 5 box, another 5, 15, 20, 30, 35, sorry, 25, 30 boxes. So I'll be calculating my complex. 1, 2, 3, 4, 5. Okay, yang ini tak kena lah, so tak kira. So 5 times 20, so the heart rate is 100. Okay? Sometimes, depending on where your boxes are, let's say if I keluar this kind of soalan in your practical or your exam. Let's say if I move this thing around, kan? Okay, for example, if I say I start my boxes from here, how many complex do I get? 6. So the heart rate would be 120. Okay, so I'm not going to fault you all if you all write 100 and 120. I will mark everything as correct. Only unless if you say, Doctor, the heart rate is only 40 and my answer is 120 and jauh benar, then meaning your calculation is wrong. Okay? Alright, if it is 40, then your dog is having what? Tachycardia ke bradycardia?
Bradycardia.
Huh? Tachy?
Bradycardia.
So it's going to be bradycardia. Okay, so how you know? You compare back with this one, all the normal parameter that I've given. Okay, which is here lah. Alright, any questions so far? Before we move on to the paling pening one sekali. No ah? Okay. No, can we go to, can you all see this now? ECG cases? Can you all
Yes.
see the screen? Okay, got
Yes.
the. So, group, group 13. What do you think? Is this a sinus rhythm? Okay, I got a problem. I don't know who is in group 13. Lai, tell me who are you? Group 13. Is this a sinus rhythm?
Hello, Doctor.
Yes.
So for our group, we answer this as yes. It is a sinus rhythm, but this one is a normal sinus rhythm.
Okay, betul. Very good. This is a normal sinus rhythm. Is there a P wave for every QRS? Is there a QRS for every P wave? Ada
Yes,
tak?
Doctor. Yes,
Okay.
Doctor.
So group 19. What do you think about the R wave? What abnormality do you think is this? Hello, group 19. Or you don't know your grouping yet?
Doctor, is it electrical alternance?
Betul? So can you describe a little bit why is it called electrical alternance? Because apa yang you nampak? How do you identify its electrical alternate? What is paling characteristic sekali?
The
Alternating
alternating
amplitude.
of
So you want to see the complexes. You got big complexes, small one, and then big R, then small r, big R, small r, big R, small complexes, big complexes, small complexes, big complexes. Okay, what will be a cause for this kind of disease? What is the common cause?
Fluid in the pericardial sac.
Betul, or either fluid in the pleural space. Okay, so what happens is normally for this kind of cases, you need to remove the fluid. So we'll do a pericardial synthesis or a thoracosynthesis. So this one I will teach you all later on lah. Okay, so we need to remove the fluid. Okay, okay. Let's go to B. Group 2. Group 2. Hello, Group 2. I didn't give you the paper speed for this one and I asked you to calculate. That's so mean. Okay, but we can still do it. Group 2. If the paper speed is 25 millimeter per second, hello, Group 2. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, and 15 boxes. Group 2. Tak ada orang kat group 2 ke? What would be the ventricular rate? Or anybody could help.
Doctor, is it 60?
How many ventricular, how many R are you getting here? 2 only, right? 1, 2. If let's say if I count, if I just highlight here 15 boxes, it's only 2 tak sampai 3 Hanani. So 2 times 20, 40. Okay, so when you talk about ventricular rate, you're actually referring to the RQRS. Okay, so it's only 40. So the ventricular rate is 40. All right. Is there a
But
P
doctor,
wave?
sorry, doctor, but if we put it right a bit, then it will be 60.
But that one, but this one, this one is T wave. When you want to have the whole complex normally, you tak mau setengah-setengah complex and say, oh, this one also calculated. You want the whole complex. Okay, so yang ini tak kira, yang ini tak boleh kira. Okay lah, kalau you kata tak aci lah doktor, you start with something which is I can see one. Okay, I will say okay. So let's count another 15 boxes. So here, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Okay, if you put here to here, again, you don't have the full complex. Okay? So pun tak kira. It's still about 40. Okay? Is there a P
Sorry,
wave?
doctor, I have a question.
Yes?
When we're counting the complexes, are we counting the R or the whole complex?
The
From P
whole
to T?
complex. The whole
Okay.
complex. Okay? It must be the whole complex. Alright? So that's why normally I wouldn't want to start from here lah. I might want to just start from here. So it doesn't influence anything else. Okay? It should be the whole complex. Okay, what do you think about the P wave? Do you see P wave? Do you see P wave? Tak ada.
No
Hanani
P wave.
say. So there is no P wave and all you get is the QRST. Okay, so this dog, there's no P wave, so it shows that there is a premature beat going on. So this one is referred to as ventricular escape beat. Okay, so this one is ventricular escape beat. Because this one, they are all wider, a little bit wider than normal. Okay, so the atrial is also standstill, so there is no P wave, so it's atrial standstill. So in any cases which is animal have got atrial standstill, then the treatment would be you can do atropine, but to check if this is the true atrial standstill, if not, then this dog will need a pacemaker lah. Okay, so this one is atrial standstill, no P wave. Any soalan? Any question?
Hello, doctor, I have a question.
Yes.
There's also no Q wave, right, in this ECG?
No P wave, then QRST.
Q wave.
Q is just here. Your Q. There's no P.
I
There's
guess
always a
Q.
Q. Q, R, S, T. Maybe I make it bigger. This is the Q. Then your R, a very deep S. Then this is T. Okay, your T is even higher than your R wave. Okay, you got a very tall T, we've mentioned just now. Okay. Okay. Normally, you don't have something that has got no Q one. All right.
Hi, doctor. Just want to confirm. So if we want to calculate the heart rate, we want to count PQRST, right?
The whole complex. But
Yeah,
this one has got no P. This one has got no P. So the question is, where is the ventricular rate?
So just QRS.
Just QRS is also fine. But actually, let's say the way, I mean, like just now you all say 60, right? I think that's acceptable also lah. Because if it's gonna be ventricular rate, so it's either you get 40 or either it's 60. I think I can accept 60 lah.
Because is the ventricular rate like kind of similar to the heart rate?
No, not really. Ventricular rate, you just want to look at the R. And you can have atrial rate also as well. Then atrial rate, you just want to look at the P. So sometimes if they are having this arrhythmia, they're having rhythms issue. So normally we won't be able to calculate the heart rate. The heart rate is just going to be going beyond 200 because all you get the calculation is incorrect already. So for example, in this kind of cases, let's say if you've got, okay, something below here, you just say, doctor, just now the heart rate by right, it should be, look at the ventricles, isn't it? Look at the R, isn't it? So let's say if here got nothing, then there's no heart rate. So the ECG trace will give you an average from here to here. So they will just tell you there's only 4 heartbeat in that period of time. Or if he started to calculate from here to somewhere else, then he will be saying that, oh, the report will tell you that, okay, there is 80 beats per minute. So it depends on where the calculation is. Okay, so for this one, it's just ventricular rate. So if you're looking at ventricular rate, you just look at the R lah. Make it easier, just look at the R. So this one, in 15 boxes, you have got 2 R, so it's only 40 beats per minute. Over here, in that 15 boxes, you found 3 R, 60 beats per minute. So let's say if you answer in your exam, you give me 40 or you give me 60, I'm acceptable to it. Anyway, these two numbers is already bradycardia. Okay?
Thank you, doctor.
Yes, atrial beat, you only calculate the P. So like, okay, never mind. We go further first. Okay, so just now this dog, bradycardia, will need a pacemaker. The atrial stands still. Okay, the P wave is not there. Okay, how about this one? This one will be group 9. A 10-year-old Cocker Spaniel cross presented with history of episodes during which her legs play out after she struggled to stand again. Okay, then they got this trace. Okay, so perhaps maybe this sounds like a collapse, but not sure. And then when she wants to get up, it's a bit difficult. Okay, so what term would you use to describe the 5th complex? So let's look at lead 2. 1, 2, 3, 4, 5. Group number 9, what do you think? This one make it bigger lah. Group number 9, what do you think? Are you able to see PQRST? Who is in group number 9? Who is in group number 9?
Doctor, can I help?
Yes,
I
can.
I did the question also. Okay, so what term would you use to describe fifth complex? We're not very sure, but I think it's apa nama dia? Sick sinus syndrome.
See, sinus syndrome, not really, because you have your PPP all here. This one no P only. This one P also don't want to say anything. You have a P, but P is not appearing here. So P, Q, R, S, T. P, this one, I don't even know if it's a P, but instead of waiting for the P to say something, this one comes in already. So this is a T, a P, Q, R, S, T, P, Q, R, S. Don't know. Or maybe this is the P, dia tercepat, and then QRST. So this P is slightly early. So this one is atrial premature beat. Okay, but over here, what do you think about the P? All this line over here.
There are
So
no
you're
P.
gonna have no P. So it's atrial standstill here. Okay. All right, so there's atrial standstill. Then the ventricle starts to, the AV node starts to say, hey, something is wrong already. Quickly jumpstart back again. That's why you have your QRS. And there's no T also. Okay. What is this negatively deflected? I don't know. Right? Is this a P? But normally P also don't negatively deflected. Don't know what is this. Then you have your QRST. This is T negatively deflected. Okay, something is going wrong already, then it starts to have a normal complex back again. Okay, you can see the T here is also negatively deflected, but it was positively over here. So wandering pacemaker normally is either you seen them, you don't see them, or they will fuse together, or they will appear after. So the P's are not sitting at the proper pace. Okay, so this one could be just a atrial premature beat lah, started to kick off first, then that's why you have got a complex after that. Then number 6, the question for the following complex is number 5. This is all atrial standstill. Okay, then suddenly you have got an escape beat of the ventricle. All right, so it came back and then everything went okay. This one is a little bit harder, this question. Okay.
Doctor, can I ask? I have
Yes.
a question. So doctor, what's the difference between sick sinus syndrome and atrial standstill? Because they look similar.
Atrial standstill means they stand still, nothing. This is atrial standstill. Atrial not doing anything. This one is atrial standstill. Sick sinus syndrome, they will appear, sometimes they don't appear, sometimes the PR interval is very close. You get to see a variation. So the question over here is, what occurs following after 5th complex? So this one lah, atrial standstill. Okay, what terms do you describe the 5th complex? So this one is just referring over here. So for sixth sinus syndrome or wandering pacemaker, normally you need to see the entire trace to tell you that what is happening. Okay?
Okay, thank you, doctor.
Mm. This one. What abnormalities do you see? Group 4.
Doctor, atrial fibrillation?
Can. Okay, this one, do you see P wave?
It's poorly defined.
Okay, you can't see the P wave very well. All right, so this one is atrial fibrillation. You're right. Okay, this one normally lead to, if you tak cukup, right, normally they will give you another strip of leads down over here. Okay, so don't worry about treatment. All right, because I'm not going to teach you all that one at the moment. Okay, let's go to G. So the origins of all these beats, where are they coming from?
ST, doctor.
Hmm?
ST.
ST?
Ya.
Kenapa ST? Yang ini semua adalah ST ke you rasa? The original of all these beats, where are they coming from? Is it the atria or is it the ventricle? Kalau you get all these bizarre beats. This one, this one. Atria or ventricle? So an answer is ventricle.
Ventricle.
Okay? Answer is ventricle. So what do you think they are all looking like? Are they ventricular tachycardia? Or upper? White, bizarre, complexes. What are they? What are they? They can be your VPCs, your ventricular flutter pun boleh. Okay? Are they focal or multifocal? And multifocal, focal means one like that only. Multifocal means they appear all over the traces. Okay, at different area. All right, there's no P. Okay, maybe this is P, QRST, P, QRST, P, QRST. It took them a little bit longer. Then you have a P, QRST, P. Wow, white bizarre. Don't know what is that. This could be just one VPC. If you have more than one VPC, you have three of them or couple, then you call them ventricular flutter. Okay, if it becomes even worse like this ZZ, then you get ventricular fibrillation. Okay? Okay, this one also don't worry about treatment. Okay. What about this? Group 12. What do
Doctor,
you think is the ventricular rate? Yes?
actually, I have a question.
About?
So, the G question.
Yes?
G. So, what the speed that we need to use in this graph based on this graph? Because they didn't mention the speed for this. So we count for both of it, 25 and also 50.
Oh no, because I wasn't giving you a calculation for this one. Normally the paper speed they will indicate over here. Okay, let's say if you want to give it a practice, let's say that this paper speed was 50 millimeter per second. Okay, I count you the 30 box. So let's say we start here lah, nanti. What am I doing? Okay. Let's say we start here. 30 box. 30 box a bit too much. Never mind. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 24, 26, 28, and 30. Okay, what would be the ventricular beat? Let's say if this is a paper speed of 50 millimeter per second. Thirteen, 14, 14, 14 complexes. 14, so
14.
what's the heart rate? 14 times 20.
280.
So is that a tachycardia?
Yes, doctor.
Okay, so if ventricular beat, so normally VPCs lah, ventricular tachycardia, ventricular fluttering, ventricular fibrillation, this is what you get lah, high heart rates. Okay, so the ECG trace, they will calculate the heart rate for you, then it will come up as everything which is going to be abnormal. Okay? So let's say this dog, age is 7-year-old or old hunter weight, which has got a exercise intolerance. So what is the sinus rate? Group 12? Sinus rate? Kalau you say sinus rate, which one should we be looking at? Lead 1 ke lead 2? Let's say if this paper speed is 50 millimeter per second. Okay lah, we count together lah. Okay, what am I doing? Nonsense only, what am I doing? Okay, let's start with 2, 4, 6, 8, 10, 2, 4, 6, 8, 10, 2, 4, 6, 8, 10. Okay, 30 boxes. Lai, what is the sinus rate? Ada berapa sinus?
Doctor.
15 ke? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. Mana you punya 15? 14 lah, discount 1 can or not? Okay.
14, doctor.
So 14 times 12 is what? What is 14 times 12?
168.
Okay. So is that fast? Fast lah. Alright. Okay. What is the ventricular rate? If this is a 50 millimeter per second, what is the ventricular rate? How many R do you get? Lawrence? 2. So then your ventricular rate will be
40.
40. Okay. So 2 times 20, yeah. So 40. So what rhythm abnormality do you think it is? This one is all atrial upper. I know dia bradycardia lah. Tapi dia punya atrium pula tachycardia. So what is the rhythm abnormality over here? What do you think is this?
Doctor, is it
Atrial upper.
ventricular? Oh, it's
This one is the abnormal one ma. Okay. Just now what you want to say? Is it what? Ventricular something you mentioned.
no, doctor. I just thought it was ventricular bradycardia.
Oh no. This one there's something wrong. That's why the ventricle is not beating. So this is only P wave, P wave, P wave, P wave, P wave, P wave. So if it is only just P wave, so if you look at the lecture notes, what is it? You got P wave, P wave, P wave, P wave, P wave, P wave. Your atrial flutter, or if you want to say there could be a possible third degree AV block, but this ventricle also pelate. Okay. Okay, so you got a VPC over here, and you got an atrial flutter, or you want to say this has got a third degree AV block. All right. Okay, so for your exams, I'm definitely going to put up all these kind of pictures up and then get you to name. Okay, and then we'll give you all calculation also as well. And then so hopefully it will be okay. So you just need to prepare your calculators. Okay, and read up lah. How do you calculate the heart rate? And how do you look at your PQRS complex? Okay? Okay, that's it for this one. Any questions so far? Can you give us a reference range to use? Okay, I need to go to that chat box. Apa you tulis? Can you, Doctor, can you give us the reference range used in UVH for atrial and ventricular rates? Or just use the range for heart rate? What do you mean? When you calculate atrial and ventricular rates, is normally on abnormal ECG. There is no normal, there's no abnormal one. If you calculate heart rate, then you want the entire complex. For example, we go back to Oscar. So, okay, if I ask you about atrial rates, then I will be like this one, nothing lah, calculate what atrial. If I ask you about ventricular rates, so you go and find the R, QRS, okay, Q. Okay, Wan Sing.
Doctor, so what is the significance of finding the atrial and ventricular rate?
Because they have they have arrhythmia. Because they have arrhythmia. Sorry about my cough. Faham tak? There are some abnormalities, right? If you look through the lecture notes, it's all focused on sinus. and some of them are focused on ventricular. And when you read ECG lines, you have to see PQRST, PQRST, PQRST. Sometimes you will see P with no QRST or QRST with no P. So that is why sometimes we calculate, sometimes we don't. Or sometimes you just want to look at the normal pattern only. Okay, one thing.
Okay, doctor, I will try to understand.
So when you look at P, the P wave, the depolarization of, then it will give you P. So it starts from the atrial. So it's actually telling you that the atrium is beating too fast. If it is atrial fibrillation, if it is atrial flutter. Okay. So let's say if it is P wave, normally
Hi,
in any
doctor.
ECG.
Doctor, sorry, are you sharing your screen?
No,
Tak?
I'm not sharing. Tak share. I'm just
Okay,
saying
okay.
only.
Okay,
So normally for P wave, you want to know whether there is P or not. Okay, put it this way lah. When you see a patient that time, right, and they are already moribund, they are lifeless, and you listen to the heart rate, sometimes it's low. You know it's bradycardia because you calculate bradycardia. You calculated the rates and it was low. But if it is slow, you want to know whether is this patient dying and what is this arrhythmia. What is the arrhythmia that the patient is having? So let's go back to the lecture notes that we had today. Say this one. This one normal. Okay, the problem lies in the sinus. This one got only 3 different things only. You get bradycardia, tachycardia. Wandering pacemaker is only the P wander around, but you still have a proper sinus impulses formation. Okay, you have this ventricular impulse formation. This one never listen to anybody anymore. The ventricles are just beating, 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 beating. All right. Okay, so sometimes when you look at atrial standstill, atrial not, there won't be any sinus rate at all. Okay, they keep quiet only. Or you will have sinus rate, but this sinus rate is slow. Okay, then this sinus rate totally cannot calculate lah, because they will be fluttering away. Or this one, atrial fibrillation. Okay, for example, where is it? Nah. You can see my screen now?
No.
Aiya.
Doctor, cannot.
Ni, I go back, do one more time.
Okay, thank you, doctor.
Just now memang I tak share screen. Sengaja, tapi now perlu. Okay. What Wan Xing asked, why you want to make us calculate sinus rhythm and atrial rhythm and ventricular rhythm? That is because sinus impulse give you normal complex. This one, every P got QRS. This one, every QRS got a P. They hold hands together one. Okay. This one also sama. They hold hands together. Every P got QRS, every QRS got P. Okay, it's just that in wandering pacemaker, dia kejap ada, kejap tak ada, kejap slow sikit, tapi P itu memang ada. Alright. When you have a patient that is, sudden death, not sudden death, collapse, or moribund, or maybe because it's having hyperkalemia, and okay, in hyperkalemic patient, normally they will have bradycardia. Okay, the potassium levels are very high, they will have bradycardia, right? But they are actually having arrhythmia and often associated to, where's my block? SA block. I didn't write my SA block. There's sinus block. Okay, they will have sinus block. Then normally the heart rate rhythm that you get is very slow. So if it is very slow, you want to know why it's slow. That's why you do an ECG to see the PQRST, whether the PQRST is normal atau abnormal. Okay, so let's say if you say, let's say we go very simple example. SA block. Where is my SA block? Mana ya? Okay. You see, if you are calculating SA block, what's going to happen is, for example, this one. Okay lah. You see this one, you get normal heart rate, isn't it? Okay. So SA block, this one sometimes will give you a heartbeat also as well, you know. If you don't know how to listen, you're going to get dub here. Dub. You thought it was a dub. And it's very hard to for a young one to calculate heart rate. Sometimes you just hear lup, okay, it's just one beat already. Lup, it's just one beat already. So that's why we need to calculate. So if in ECG, you will definitely get only one P wave, okay, and it's not followed by the R wave. So for this kind of case, it's still going to be bradycardia, but you have got an atrial beat, but your ventricular beat is going to be even slower. So when you know that these two are not consistent, by right, you should have one atrial beat, one ventricular beat, one atrial beat, one ventricular beat. Okay, if it is 120, it should be 120 P wave, 120 your R wave. For this kind of case, you're just going to have P, P, P. Your sinus, your atrium, the atrial rates only. Then your ventricular rate is going to go missing because by right, it should be followed with your QRS and your QRS and your QRS. Okay, calculation is only an exercise just to find out whether you know how to calculate and identify where is your P wave and your R wave. All right, but in theory, in real life, when you see these traces already, you will not be sitting there calculating the P wave and the R wave. You will be finding out what's wrong with this patient and quickly correct it before it dies. Okay? Okay, that calculation is...
Okay, thank you very much, doctor.
Okay? Any other question? If not, we should have some fun already. Wait, what am I doing? Can you see screen of all these different dots?
Yes, doctor.
Okay. You tell me whether you can hear sound.
Can hear, doctor.
Can hear. So ugly, my picture. Okay. So what we're going to do for the next half an hour, is to appreciate some sound. So for those of you who are not putting on your headphones, right? Quickly go and grab your headphone now or your earphone. I think you will hear better. Or if you are sharing PCs, then still put your earphone and you share the other one to the other friend. Boleh ke? Ayah, itu pun tak ada orang jawab.
Boleh doktor, boleh.
Ya, you orang very boring tau. Okay, wait. Okay. Can we start?
And doctor.
Doctor.
Can you look at the tongue? Cyanotic, isn't it? And it's panting, Okay. Okay. I was shown this video, say maybe in afternoon, lunchtime. And by evening, this dog already enter oxygen tank. Oxygen tank pula. Oxygen cage. Can you see? Okay, let me show you abdominal breathing. Can you see my cursor? It's already gasping for air. Okay, is the heart rate increased? What should be the correct term to describe this dog? What is this dog having?
Tachypnea.
Tachypnea, heart rate increase, respiratory rate increase. What else? What do you call this type of breathing? That cursor I put here.
Dyspnea, doctor.
Dyspnea also can. Lagi?
Labor breathing.
Labor breathing also can. Lagi? I'm still showing my cursor on the abdomen.
Abdominal breathing.
Yes, this is what you call your paroxysmal breathing, or either word you call it as abdominal breathing. Okay, so basically he's actually pushing the abdomen to push the diaphragm to help the dog to breathe. Okay? Cukup ma? Okay, let's look at this dog. This dog has gone to heaven. See the tongue color okay kan? Yeah. So this dog is actually panting, panting throughout the consult. Okay, so there is an increased breathing rate. So you look at this patient, he's having cardiac cachexia. Look at his body's condition score. Good or poor? Good or poor? Good or poor? Poor. What do you mean by poor? If I ask you to score, how do you know how to score? BCS?
Yes.
Then what is the answer? 2 Okay lah, Imran. Okay, can you see the ribs? Can you see it's very thin? This is a golden retriever. I've known this dog for maybe 3 years. Okay, but he didn't die because of congestive heart failure. He died because of liver cirrhosis. Okay, so we look at the breathing again. Okay, he's a very good dog. He will stand still. You want to take blood, you want to do anything, also can. You just put food in front of the dog. Okay. And I make all this smaller lah. Kacau aja. Okay, let's see. Okay, coughing Let's listen to some cough Very pretty kan, this cocker? Can you appreciate the cough? Boleh?
Yes.
Yes.
Okay. But it sounds like a throat clearing cough. Okay? Okay. But this cough for this dog wasn't related to cardiovascular disease. It had a very bad chronic cough going on for many, many, many months already. And it was a respiratory issue for this dog lah. So cardiac cough are not like this. These are cough, but often this cough is related to respiratory. So for me, being a vet even up to today, I don't listen to cough sound and straight away say, this is cardiac cough, this is respiratory cough. So what should I do? What should I do to differentiate this kind of cough? What should I do?
Buat ECG, doktor.
ECG teruk lah jawapan you.
Radiograph.
Kesian. Yes, you do a radiograph. Kesian Dr. Lau ajar-ajar. You kena the ECG. Okay, ECG is not going to give you anything. Alright, ECG is not going to tell you if this is going to be a respiratory disease or a heart disease. Okay, let's listen to another cough.
Sejuk dia macam
Okay, another cough. Did I scare you? No, doctor. Okay. Yeah, this is also another cough, All right. But this one for this dog was also a respiratory cough. Okay. In cats. This one is very painful to watch, I warn you all first, I don't like watching all of them become like that. Okay, let me turn around first. I don't know why all my video. Go. Very moist, the cough, isn't it?
Okay.
All very phlegmy, that's why you got that. Okay, it's not comfortable, that's why it's doing this teeth grinding. Okay, coughing, Okay. Let's look at this cat. What do you think this cat is doing? Why all the video? Sorry lah, people. Okay, what is this cat doing?
Panting.
Panting like a dog. Is it normal for cats to pant? Is it normal for cats to pant?
No.
Not all breeds.
Okay, what do you mean by not all breed? Cats are not supposed to pant. Cats don't pant unless it's under the heat, right? And then he was trying to emit the heat away, then yes, they will pant. But often in cardiovascular disease, if they pant after playing, that's an indication of exercise intolerance. Okay, another one more cat. I show upside down again. They all the video upside down. Okay, let me upside down, then only you'll watch. Let me restart the video. What is this cat doing? Sorry, I kacau again. What is this cat doing?
Open mouth breathing.
Okay, lagi.
Gasping for air.
Gasping for air. What else? You see the abdomen? It's an abdominal breathing also as well. Okay, so you have heard coughing, you have seen panting, you have seen abdominal breathing, you have seen tachypnea, you have seen dyspnea, you have seen what else? Don't know lah, don't know what else already. So you have seen all those, So all those I've already mentioned in the lecture. Now, there are other sounds also as well, but often in cardiovascular disease during consult, I will do one thing. I will do a tracheal pinch. Okay? Watch how I do this. Yes. Ugh. Wait. Okay, wait for a while. Computer not happy already. Any questions so far?
Doctor, I missed where you said the reason you did the tracheal pinch. Why did you do that?
Oh, I want to listen to cough. Cardiac disease cough has got a very typical cough. It's just that my computer jam up right now. Or not, I want to show you the video. I will do a tracheal pinch. What I'll do is, what I'll do is I will feel for the tubular structure at the neck over here. By anatomy, how many structures do you have here? At the neck? How many?
Two.
Two. What are those two?
Esophagus and trachea.
Trachea. So what I'll do is, you can do on yourself, but you don't choke yourself. So what I'll do is, I will hold on to my trachea and I will pinch it. Okay, so once you do that, it will cause an irritation to your trachea. Automatically, a person will cough. Okay? How Why he jam leh? Boy. Okay, so normally I will do a tracheal pinch lah. Tracheal pinch will then after that tells me whether this cough does really sounds like a cardiac cough or not. Okay? Otherwise, just now you heard that Cocker Spaniel and that brown dog, isn't it? There's going to be like a cough, but normally cardiac coughs are not like that. Cardiac cough, normally the clinical signs would be like this intermittent cough. Our friend does nothing, then have that cough, and often it happens a long while ago. Owner was just waiting to watch and see, and then the frequency of the cough suddenly occurred more and more and more over the days. As for respiratory cough, they are always pretty much suddenly. Just last week, don't know what happened, there was a cough. And then that cough has been going on every single day, being very bad. So how what am I supposed to do? Am I still in the line? Am I still online?
Yes, doctor.
So how am I supposed to do? If everything decided to pause, maybe I stop share dulu kot. Kenapa dia tak happy? Okay, maybe what I'll do is I'll close all of them. Close. Okay, give me 5 minutes. Boleh?
Sure, doctor.
Maybe I was playing around with the video too much. So what was I teaching today? Practical, 10 November. Okay, let's open that back up. Okay, unhappy computer is doing fine now. Can you hear that sound?
No, doctor.
Okay, so meaning I have to, okay. Okay, I think I can do this already. I'll share again. Okay, can you see? Can you see? Make me taller. Okay, make me taller. Okay. Can hear ah? No, can. Okay, because I share wrongly.
Doctor, we could hear just now.
Yeah, then, okay, then I hear you all wrongly. Okay, let's start. Okay, so I feel at the neck, anatomy, we know there's two structures besides your blood vessels. So your esophagus and your trachea. So I will palpate the trachea. What I'll do is I'll pinch it. Okay. All our trachea is like a C ring. Okay, it's like a C ring, C ring, C ring, C ring all over. And then on top of this tracheal wall, there's actually a wall, your esophageal wall, but it's cartilage. So when you compress, it just causes an irritant. You are not going to make anything collapse. You are not going to disturb the trachea at all. The trachea is not going to break. Okay, so all you're doing is just a pinch. Okay, let's do the pinch again. There you go, the cough. Look at the owner. There you cough. Okay, but most of the time the owner at home, you always will want to ask for this.
After a few minutes, the interval will start again like that.
The owner cannot sleep.
After a few minutes, the interval will start again.
Okay, opposed to respiratory cough, you see this dog. It continues, they always continuous one, like this dog. Okay, whereas cardiorespiratory cough, their coughs are always intermittent.
After a few minutes, the interval will start again like that.
Okay, but I can tell you most of the time, I always demonstrate a cough to the owner, so I'm going to do it to you also as well, and then you will find that I'm bloody annoying, but you need to listen to it. So a cardiac cough would be like this. Excuse me first, I need to say this. A cardiac cough would be like this. Okay, there is always a gag behind that particular cough, as if they are throwing phlegm. And this phlegm is actually coming from the bronchus. All right, because at that point of time, a lot of time they would have a bronchial constriction and they would have a pulmonary edema. Okay, so there's always going to be a cough, 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 and then throat clearing, and then there will be having a gag after that. Okay, so these are the typical cough. Okay. Just now, any questions so far? Yes, no? Am I still online?
Yes, no questions from me, doctor.
Okay, so let's move on to panting. Panting, just now what you saw is all panting lah. Panting, panting like my dog panting ah. Any dog that you saw will be panting. But sometimes there are panting that will come with weird sound. Stridor, stertorous breathing are all those one. that you will describe, but often all those kind of sounds are from upper respiratory tract. For example, this dog. These are not cough. This dog has got a tracheal collapse. This is what we call reverse sneezing. Okay. This dog, if you listen to it properly, yes, this dog is actually panting. But when you listen to it properly, you will hear other sounds also as well. Panting, correct? But did you hear that? Okay, so this is also obstruction of the upper airway lah. That will be the sound. Okay, Dr. Khor very disgusting one. I always show this kind of video. Okay, this is also another one. This one is show you for fun only lah. Can you see the face? Okay, so there is a bulge there. So practically this dog is actually trying to breathe, but he's using his mouth to breathe. So at the same time, he's also using his nasal cavity to breathe. So he's got a cancer. All right. Okay, so that's about all. And our friend, I stop share dulu. I kasih dia tutup. So, okay, we got another what? 10 minutes. Any question? $10, any question? No question. Everything good? Imran
Okay,
terkejut.
doktor.
Kenapa Imran terkejut tadi? Open mouth breathing, gasping for air. Yes, is that swelling? Yes, that's swelling. That's cancer. Okay, one more last video, Ken. Oh no, I don't want to show this video. One more last video. Okay, there is a gadget that you want to use. It's an app. Let's say, okay, let me just close this lah. There is an app that we can use. I download already. So what do I want to do? I download already. There. Okay, there is this one app. So I need to share. There is this one app. I quickly made a demo video just now. And this app has been developed by panggil apa? Boehringer Ingelheim. Okay, they just launched this app, say like maybe a few months ago. So this app would be very interesting for you all to use. It's supposed to be for pet owners on how to calculate breeding rates. So just in case, you know, you don't know how to calculate your breeding rates very well, and you cannot coordinate your eye to your watch and coordinate to the dog breeding rate. So this one app will be very useful lah. So this app is available in your Android and either your Android or the iOS user. So it's called My Pet Heart to Heart. Okay, My Pet Heart to Heart. You just download this app and then you can just use it. So for example, I was playing a fool just now, so I made my dog, I put his particular inside. So you can actually just use this app. Okay, then you can set you know, how kind of breathing rate. So I wanted to calculate 15 seconds just now. So as the dog breathes, I will just tap on the heart, breathe, tap on the heart, breathe, tap on the heart, tap on that blue heart. Okay, so it will calculate that 15 seconds and then it will come out and tell me, okay, this dog has got a 24 breath per minute. So it's normal. Okay, so this is one app that you can use lah. Let's say if you have got difficulty trying to coordinate yourself. Okay, any question? Anything else? Today is a long day. Anything else?
None from me, doctor.
No, okay, if none, we adjourn. I'll see you all next week. Don't ask me what question gonna come out. Definitely questions gonna come out. Calculation also will come out. ECG also will come out. I don't know how I'm gonna do it yet, but it will come out. Okay? Dog itu bunyi buzzing surprising. Bunyi surprising. Dog itu buat bunyi surprising. Rosma, what do you Imran, what do you mean by that? Imran dah lari kot. Okay. All right. Thank you, students. Bye. Have a good dinner. Have a good rest. Okay?
Thank you, doctor.
Thank you, doctor.
Thank you, Doctor.
Thank you so much,
Bye
Doctor.
Thank you,
bye.
doctor.